As a heart surgeon with over 30 years of experience treating older adults, I've learned one painful truth. It's not always the disease that sends seniors to the hospital, it's the medications they've trusted for years. I've seen patients walk into my office with swollen ankles, strange fatigue, or a racing heart. They're confused, scared, and they almost always say the same thing, but I've been on this pill for years. What they don't realize is that some of the most common medications taken daily by millions over age 60, meds for pain, sleep, mood, or even heartburn, can quietly damage the heart, lower oxygen, or trigger dangerous rhythms. Even worse, these drugs are often prescribed by well-meaning doctors, and the damage builds slowly, silently, without a single symptom, until one day, it's too late. In this video, I'm going to reveal 7 medications that may be silently weakening your heart and why no one is warning you. Pill number 1 is the most dangerous of all, and most seniors are taking it without a second thought. This isn't about fear. It's about survival. You need to know what's happening inside your body before your heart gives you a warning you can't ignore. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. 1. Nonsteroidal anti-inflammatory drugs, NSAIDs. I still remember Mr. Harold, a 72-year-old retired mail carrier from Ohio, who walked into my clinic with swollen ankles and a tired heart. He wasn't there for heart problems. He had only come in for a routine checkup. But the look on his face told me something wasn't right. He had been taking over-the-counter ibuprofen every single day for nearly a decade to ease his arthritis pain. Like millions of older Americans, Harold had no idea that the tiny pill he trusted for relief was quietly putting pressure on his heart, day after day, year after year. NSAIDs, which include familiar names like ibuprofen and Advil, and naproxen, Aleve, are commonly used to treat joint pain, back pain, and arthritis. They're easy to find on the shelf at any pharmacy, and that's exactly what makes them so dangerous. They feel safe because they're everywhere, but for aging hearts, they carry silent, deadly risks. As we grow older, our heart muscle becomes less flexible, less forgiving. NSAIDs raise blood pressure, make the body retain fluid, and narrow blood vessels, a dangerous combination for someone over 60. These changes don't feel dramatic at first. There's no warning bell. But with each passing day, the heart is forced to work harder against the pressure. Eventually it weakens, sometimes quietly, sometimes suddenly. In Harold's case, his heart had begun to fail slowly. He hadn't noticed the signs: shortness of breath when walking to the mailbox, needing to nap more often, socks leaving deep marks on his calves, all symptoms he brushed off as just getting older. But it wasn't age, it was his medication. NSAIDs can also quietly damage kidneys, which filter your blood and help regulate blood pressure. When kidneys weaken, they place even more stress on the heart. It's a vicious cycle. For some seniors, this cycle ends in a hospital bed with heart failure, confused and scared, wondering how it all got so bad so fast, all because of something they were told was safe. And here's the painful truth. You won't feel the damage happening. You might even feel better because the pain is gone. But what's happening inside your body is anything but better. Pain relief that comes at the price of your heart is a deal no senior should ever be asked to make. Before continuing NSAIDs beyond just a few days, you must speak with your doctor. There are safer, senior-friendly options for managing pain, methods that don't carry the risk of quietly shortening your life. Mr. Harold, we caught it in time. We stopped the NSAIDs, treated the swelling, adjusted his heart meds. He's walking again, smiling, back to gardening with his wife. But many others aren't that lucky. If you're over 60 and taking NSAIDs regularly, even just for a little joint pain, your heart might be paying the price without you even knowing it. And if painkillers can damage the heart this much, imagine what a diabetes pill can do when it starts filling your body with fluid. Let's talk about the next silent danger, thiazolidinedionase. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 2. 2. Certain diabetes medications, thiazolidinedionase. I'll never forget Mrs. Evelyn, a gentle 68-year-old widow from Michigan. She'd been managing type 2 diabetes for nearly 15 years, faithfully taking her prescribed medication, pioglitazone, one of the thiazolidinedionase drugs. She believed, like most patients do, that if a medication helped control her blood sugar, it must be helping her health. What she didn't know, and what many seniors still don't know, is that this particular class of diabetes pills may have quietly been pushing her heart toward failure. When Evelyn came into my office, she complained of gaining weight out of nowhere, feeling breathless while climbing the stairs, and waking up with puffy legs and swollen feet. She thought maybe her sugar was out of control again, but her blood glucose levels were fine. Her heart, however, was struggling under a weight it couldn't carry anymore. Thiazolidinedionase like pioglitazone or rosiglitazone work by making your cells more sensitive to insulin. On the surface, that sounds like a good thing, and in some ways it is. But here's the dark truth. These drugs cause the body to retain fluid, especially in the legs and lungs. That might not mean much for a younger person, but for someone over 60 whose heart is already aging, that extra fluid builds up and becomes a heavy burden. The heart is forced to pump harder, faster, and eventually it gets tired. Over time, this can lead to congestive heart failure, even in people who never had a history of heart disease. The signs creep in slowly: fatigue, swelling, shortness of breath, sleeping upright to breathe easier. Many seniors, like Evelyn, brush these off as signs of aging, but they are not. They are warning signals. And when ignored, they often end in emergency rooms, oxygen masks, and critical care units. What's even more troubling is how deceptive these medications can be. Because they lower blood sugar, many doctors and patients focus only on the numbers. Meanwhile, the heart is silently drowning in fluid, slowly losing its strength. It's like fixing the windshield while the brakes are failing. Mrs. Evelyn's case was caught in time. We discontinued the medication, treated her fluid buildup, and placed her on a safer regimen. But not everyone is that fortunate. Some people find out too late, after a fall, a hospital stay, or worse, a heart that simply gives out. So if you're taking pioglitazone or any medication in this family and you've noticed swelling, breathlessness, or just a new, unexplained fatigue, do not ignore it. Your heart might be trying to tell you something before it's too late. And here's a chilling thought. If a pill meant to help diabetes can quietly drown your heart, what happens when the pills you take to help you sleep are actually slowing your breathing at night, possibly stopping it? You won't want to miss what's next. Sedative hypnotics may be harming your heart every time you close your eyes. 3. Sleeping pills, sedative hypnotics. Mrs. Lorraine was 74, a soft-spoken grandmother from Kansas who had recently lost her husband. Grief had taken a toll, and sleep became impossible. Like many seniors, her doctor prescribed a common sleeping pill, Zolpidem, a sedative hypnotic, just to get her through the hard nights. That was 2 years ago. By the time she came to see me, she could barely climb a flight of stairs without gasping for air. Her memory was fading, her balance was off, and her heart was starting to show signs of distress. At first, Lorraine didn't connect her health issues to her sleep medication. After all, it was just a sleeping pill. But the truth is, these pills can quietly destroy the body over time, especially in seniors. Sedative hypnotics don't just put you to sleep. They slow down your entire central nervous system, your breathing, your brain function, your heart rate. That sounds gentle. It's not. As we age, our heart becomes more vulnerable. Sleep medications like Zolpidem, Ambien, or older drugs like diazepam, Valium, don't just help you sleep. They reduce your body's ability to respond to oxygen stress while you sleep. For seniors, that's dangerous. These drugs can increase the risk of sleep apnea, a condition where your breathing stops repeatedly during the night without you knowing. Each pause deprives your heart of oxygen. Night after night, your heart is starved in silence. Sedative hypnotics also interfere with medications like beta blockers, commonly used for heart disease. This interaction can dull your body's natural warning signs and make existing heart problems worse. Lorraine, for example, had begun experiencing irregular heart rhythms in her sleep. Her body would wake up gasping, her heart pounding. But she never remembered it the next morning. That's what scared me most. Her body was crying for help, and she had no idea. Over time, these pills also contribute to falls, confusion, and memory loss. I've seen patients brought into the ER after midnight falls, broken hips, head injuries, all because they woke up disoriented or stumbled in the dark. One pill, meant for peace, can turn into a cascade of life-changing problems. The price of better sleep shouldn't be a weaker heart, slower brain, or a broken body. There are safer, non-drug ways to improve sleep, methods that won't threaten your health while you rest. If you've been taking a sleeping pill every night for weeks or months, it's time to ask your doctor, is this still safe for me? Is there another way? Lorraine eventually stopped the sedatives. We worked on her sleep hygiene, found gentler options, and supported her grieving process in healthier ways. Her energy is slowly returning, and she tells me she sleeps better now than she did with the pills. But not every senior is lucky enough to get that second chance. Now imagine you're taking something not for sleep, but for your mood, your pain, or even depression. And that pill begins to change the way your heart beats. What if the medicine meant to help you feel better is actually making your heart skip in dangerous ways? Next, we'll talk about tricyclic antidepressants, a group of medications still quietly putting senior hearts at risk every single day. If you're still watching and finding these insights valuable, please comment number 1 below to let me know you're here. Now let's keep going with point number 4. 4. Tricyclic antidepressants. Mr. James was 76, a retired mechanic from Indiana. Strong-willed, kind-hearted, and quietly dealing with chronic back pain and lingering depression after losing his brother. His primary doctor, trying to help, prescribed him an older antidepressant, amitriptyline, part of a group called Tricyclic Antidepressants. At first, he said it helped. His mood lifted a little, his sleep came easier. But within a year, James was in my office, pale and dizzy, with a heart that wasn't beating right. He had been blacking out occasionally, once while mowing his lawn. His wife noticed he would stop mid-sentence and seem confused. He thought it was just aging. It wasn't. His heart was slowing down in a dangerous way. Tricyclic antidepressants, like amitriptyline or nortriptyline, were developed decades ago. They were lifesavers at the time, but medicine has evolved, and unfortunately these drugs haven't aged well with the population now taking them most, seniors. These medications interfere with the electrical signals in your heart, the very rhythms that keep you alive. For older adults, especially those with already fragile cardiovascular systems, this interference can lead to arrhythmias, heart block, dangerously low heart rates, and sudden drops in blood pressure. James's heart was experiencing what we call bradyarrhythmia, a dangerously slow rhythm. His blood wasn't circulating properly. It explained his fatigue, memory fog, and even the moments where he felt off, but couldn't explain why. He was lucky. A simple medication review and a change to a safer, more modern antidepressant may have saved his life. But what if we hadn't caught it in time? These older drugs also raise the risk of falls, confusion, and fainting, especially when mixed with other common prescriptions. For seniors, a fall isn't just a bruise. It can be a broken hip, a hospital stay, or the beginning of a long decline. The cost of ignoring this isn't just physical. It's emotional, financial, and deeply personal. I tell every older patient the same thing. If you're still taking a tricyclic antidepressant, please don't assume it's harmless just because you've been on it for years. Our bodies change after 60. What once helped you may now be silently hurting you. Ask your doctor if there's a safer option, because in most cases there is. James now takes a newer antidepressant, one that's easier on his heart and mind. He's back to helping his grandkids fix up old bikes in the garage, but many others aren't so fortunate. And by the time they realize what's happening, it's already too late. But here's something that might surprise you even more. There's a tiny pill millions of Americans take during allergy season just for a stuffy nose that can skyrocket blood pressure and make your heart race like a drum. Next, we'll talk about decongestants and why something that seems so minor can be devastating for your heart. 5. Decongestants. Mr. Carl, 81 years old, was a proud veteran from North Carolina. A widower, living alone, sharp-minded and independent. Every spring and fall, when allergies flared up, he reached for the same over-the-counter cold medicine he had used for years, one that contained pseudoephedrine, a common decongestant. It cleared up his nose, helped him sleep, and he never thought twice about it. But one morning, Carl woke up with his heart pounding like a hammer, his face flushed, hands trembling. He was rushed to the ER with a dangerously high blood pressure reading and a rapid, irregular heartbeat. That's when he came to see me, confused and scared, not understanding how a simple allergy pill could nearly stop his heart. Decongestants like pseudoephedrine or phenylephrine work by narrowing your blood vessels, not just in your nose, but throughout your entire body. That includes the arteries that supply blood to your heart and brain. When those vessels tighten, your blood pressure rises and your heart is forced to beat faster and harder. For a younger person, the body might handle that stress. But for someone in their 60s, 70s, or beyond, especially with underlying heart conditions, that can be catastrophic. These medications are sold over the counter, so they feel harmless. But for seniors, they can silently trigger heart attacks, strokes, or dangerous arrhythmias, especially if you're already on medications for high blood pressure or heart disease. And because the symptoms often feel mild, just a racing heart or some dizziness, they're easy to ignore until it's too late. Carl told me he had been taking the same pill since his 50s. What his body tolerated back then, it could no longer handle now. That's the dangerous part. Our bodies change, our hearts age, and the pills that once felt harmless can suddenly become lethal. We stopped the decongestant, adjusted his medications, and he made a full recovery. But I've seen too many seniors who weren't as lucky. Some never made it out of the hospital. If you're reaching for a cold or allergy medication, read the label carefully. If it says pseudoephedrine or phenylephrine, stop and talk to your doctor first. Because what you take for a runny nose might push your heart to the edge. And if that's the hidden danger of a simple cold pill, imagine what could happen when you're taking something every day for years to fight heartburn. Up next, proton pump inhibitors and how they may be quietly weakening your heart from the inside out. 6. Proton pump inhibitors, PPIs. I remember Mrs. Carroll, a 70-year-old retired schoolteacher from North Carolina. She had been taking omeprazole, a common proton pump inhibitor, PPI, every morning for almost 5 years. It helped with her acid reflux, and she said it allowed her to enjoy her coffee and toast without the burning in her chest. "It's my miracle pill," she told me, until it almost stopped her heart. Carol came in with complaints of extreme fatigue, muscle cramps, and a strange fluttering in her chest. Her lab work revealed dangerously low magnesium levels, so low that it was starting to affect her heart rhythm. That's when we traced it back to her daily PPI. What she didn't know, and what many seniors don't realize, is that long-term use of PPIs can block your body's ability to absorb magnesium, a mineral essential for keeping your heart rhythm stable. Over time, PPIs also interfere with calcium and vitamin B12 absorption, weakening bones and leading to fatigue, memory issues, and nerve damage. But the most urgent danger, they may increase your risk of heart attacks and chronic kidney disease, especially if taken beyond a few weeks without proper medical guidance. In seniors, the balance of the body becomes more fragile. Stomach acid isn't just a nuisance. It plays a role in digestion, nutrient absorption, and even immune protection. When you suppress it for too long, the entire system can suffer. In Carol's case, she had unknowingly traded short-term comfort for long-term harm. And she wasn't alone. Millions of seniors take PPIs daily without any reassessment. The truth is, PPIs were never meant to be lifelong solutions. They were designed for short-term relief, but many people stay on them for years, silently putting their heart, kidneys, and bones at risk. When I stopped Carol's PPI and helped her transition to safer alternatives, her magnesium level stabilized, her heart rhythm normalized, and her energy returned. But not every story ends that way. If you're over 60 and taking a PPI every day, ask your doctor if you still need it. Don't wait until a strange heartbeat or fatigue becomes a full-blown emergency. That little pill might be costing you more than you think. And if that scares you, just wait. There's one more pill, commonly used for blood pressure and chest pain, that can slow your heartbeat to dangerous levels, swell your legs, and send your energy crashing. Next, we'll expose the hidden risks of calcium channel blockers and why seniors must be especially cautious. 7. Calcium channel blockers. Mr. Walter, 79, a proud Korean War veteran from Texas, came to see me complaining of swollen ankles and a strange, heavy feeling in his chest. He'd been slowing down lately. No more long walks with his dog, no more fishing trips with his grandson. He thought it was just age catching up with him. But when I looked at his chart, one medication caught my attention, verapamil, a calcium channel blocker he had been taking for years to control his blood pressure. Calcium channel blockers, including drugs like verapamil and diltiazem, are often prescribed to treat high blood pressure, chest pain, or heart rhythm disorders. They work by relaxing blood vessels and slowing the heart, but in older adults, that slowing down can go too far. What many seniors don't realize is that an aging heart doesn't always recover from being slowed too much. In Walter's case, his heart rate had dropped to the low 40s. He was constantly dizzy, lightheaded, and dangerously close to fainting, what we call bradycardia. Worse, the medication had caused fluid buildup, making it harder for his heart to keep up with his body's needs. These pills can also interact with other heart medications, making them less effective or increasing side effects. Over time, that can mean the difference between managing your condition or landing in the ER. For seniors, that's a risk too big to ignore. We adjusted Walter's treatment, switched him to a newer, safer option. Within weeks, his energy began to return. But if we hadn't acted in time, the price might have been heart failure, or worse. Now you've heard the 7 pills, but what if I told you the biggest danger isn't just the pill, but not knowing what questions to ask before you take it? Let's bring it all together in a final message that could save your life or someone you love. When medicine helps and when it hurts. As a heart surgeon who has spent decades caring for older adults, I've learned that the greatest danger to your heart isn't always the disease. It's the quiet damage that builds up from the very pills meant to help you. Each of the 7 medications we've explored, NSAIDs, diabetes pills, sleeping aids, antidepressants, decongestants, PPIs, and calcium channel blockers, has a legitimate medical purpose. They are not bad drugs, but in the aging body, what once healed can now harm. With slower metabolism, reduced kidney function, and more fragile heart rhythms, your body responds differently after 60. Side effects appear slowly, subtly. A little swelling, a bit more fatigue, a skipped heartbeat, often dismissed, often deadly. I've seen too many patients like Walter, Clara, Evelyn, good, honest people who trusted their prescriptions but paid the price with their health. The cost? Loss of energy, hospital stays, fear. Sometimes the cost is life itself. This isn't about panic. It's about empowerment. You deserve to understand the pills you're taking. You deserve the right to ask your doctor, is this still safe for someone my age? And most importantly, you deserve to live, not just longer, but better. Your heart has carried you this far. Now it's time to protect it. Stay curious, stay vigilant, and never stop asking the one question that could save your life. Is this medicine helping me or hurting me? Because in the second half of life, wisdom isn't just about what we do. It's about what we choose to stop doing. These lessons are meant to inspire you to live fully and authentically. Now, I'd love to hear from you. Take a moment to reflect and share one thing you've learned and plan to apply in your own life. Let's support each other on this journey toward embracing these truths. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.